Welcome back, everyone, to Michael Clayton Live. This segment is brought to you by Arrow Environmental Services Pest Control. We thank you so much for your support. As the pandemic continues, we want to bring you information that to the people who really are on the front lines of these things, those who are expertise in their field, those being doctors, and also to those who are being affected. And today we got a double whammy. Today we have a board-certified anesthesiologist, Dr. Trelvis L. She joins us now from her home. And Doc, thank you so much for joining us today.
Absolutely. My pleasure.
Recently, I heard information that you traveled to Chicago to see your mother who was diagnosed with COVID-19. Tell us a little bit about that visit.
Actually, we traveled to Georgia.
I'm sorry.
Yes. I went to visit my mom who tested positive after her sister fell ill. And so under precaution, they tested my mother, who was then determined to be positive as well.
Tell us a little bit about how that visit went in terms of your contact with your mother. Were you able to see her at all?
Well, I got a call that my aunt was not doing well. So I immediately planned to drive up with the intent of seeing my aunt in the hospital, only to find out that I could not see her, even though she was critically ill. Additionally, that day that I was driving to see my aunt, I found out that my mother was admitted and determined that she was going to be placed in isolation as well. And once she was placed in isolation, then I could no longer see her also. So it's been very difficult.
Were your aunt and mother living together?
Yes, they lived together for 40 years. My aunt came to live with us when I was in high school. And she's a primary caregiver for my mother. My aunt was more able-bodied than my mother, although she had more pre-existing medical conditions. But my aunt was able to do most of the cooking, the cleaning, the general duties of the household. My mother was able to walk and do things and was conversant and alert, but she ambulated with a walker. So my aunt was a primary caregiver for my mother.
Tell us a little bit about your aunt. Unfortunately, you told me that she passed away just a couple of days ago. How did that process go? I'm sure that the family members were not able to really see her, or you weren't able to see her. How was that on a personal level for you?
Right. Well, upon hearing the diagnosis, I immediately knew that the course could potentially be rough. As I said, she had pre-existing medical conditions, which is a higher risk factor for mortality with the COVID-19. Once she was isolated, as you said, no, I was not able to see her ever. I was able to keep in constant contact with representatives from the hospital, with nursing staff, with physicians. They were very cordial in receiving my calls and often would call me back. But the emotional toll it takes when you know that your loved one is going through such a very devastating ordeal, and to not be able to be present, to tell them that you're there, that you're praying for them, to let them hear your voice, to encourage them in any way that you can. That was the most difficult aspect of it all, because on the one hand, you do believe somehow that if they can just hear your voice, if they can see, or in some way, in her case, she was on the breathing machine, and became unresponsive after a while, but still you believe somehow that if someone she loves is there, then it might make a difference. And having never been able to see her through this, my brother dropped her off at the emergency room on a Sunday evening, and that was the last that we saw her. And then 18 days later, she passed away, and we never saw her.
I'm so sorry to hear that. Being that your mom and your aunt were both homebound, and how would you suspect that they attracted the COVID-19 virus?
My mom and my aunt were the matriarchs of our family. So they would, on different intervals, have various guests, whether it's relatives or friends, and oftentimes church members. Often on Communion Sundays, they would get communion services done at the house. It could be any variety of folks that just love my mom and my aunt who would come to visit. But we've never been able to identify who the individual was. The epidemiology department for the state of Georgia has tried to investigate that, but it's not determined who that person was that was the carrier of the virus at the time. So I don't think we'll ever know who that was.
How's your mom doing right now?
She's doing okay. She suffered some complications from just prolonged hospitalization and isolation. She has some mild dementia. Where she was able to ambulate prior to going into the hospital, she can no longer walk at this time using her walker. She's not able to use because with the isolation from this virus, they limit the services that they allow for these patients. So she did not receive any physical therapy or any kind of occupational therapy. Only the company of her nurse and the attending physician were allowed. So right now we are dealing with trying to get her some physical therapy so that she can walk again. She was in the hospital for 8 days and completely left in the bed. But attended to very well by the nursing staff, but still she was not given any services to assist her otherwise.
Well, I know your mother, you said, was asymptomatic. Were there any things that your aunt went through that you may have heard about to alert that she might be dealing with COVID?
Well, being that they live there together, only when visitors come would you even recognize that she was ill. My aunt was not one to draw attention to herself, so she certainly wouldn't have told anyone that she was feeling ill. On the 15th, I believe, on a Friday the 13th, I believe it was, someone did take her to the emergency room. She just generally said that she wasn't feeling well. The emergency room discharged her on that particular day, but my brother came to town on that weekend and saw that she was having difficulty breathing. She looked generally tired, very fatigued. She had diarrhea, lots of diarrhea, uncontrollable diarrhea. And he forcibly took her to the emergency room. She had a fever at that time and was finding it very difficult to breathe. And so they admitted her to the hospital on that day, which was a Sunday evening. And 2 days. Go ahead.
Would you say that was February 13th or March 13th?
March 13th.
March 13th. So being that, when did the medical field find out about COVID-19 and the ramp up and people attracting this virus? Like when were the doctors really alerted? Because is that unfortunate that they didn't test your aunt at that time? How was that process?
I think that even for myself and my colleagues here, no one was really discussing it at length. We knew that it existed. We knew about the symptoms vaguely. We knew, that in order to protect yourself, there were certain things that would be beneficial, such as the N95 masks, shields, and the various things that we routinely use for patients in isolation. But I don't think in January, February, we weren't really talking about, in the clinical setting, we were not really talking about the coronavirus at length. It was somewhere in the beginning of March that I can recall heavy, serious conversations being had regarding the coronavirus, its symptoms, and what the outcomes were at the time. So I think at the point that my aunt perhaps contracted the virus, which was likely the early March, the general population certainly would not have been aware, and certainly we're not talking about it to the degree that we are now, certainly, about the virus. So it would have been not the first thing to consider on a differential diagnosis when she was admitted to the emergency room at that time.
Before we take a quick break, I want to ask you for two different perspectives. One being on the virus itself, where we are in the country from your expertise. We see the numbers growing up. What do we have to do, in your opinion, to kind of help flatten the curve? And then I want to get your perspectives on mask wearing and the importance of people, casual citizens just wearing the mask, or the rampant search for masks being that of in the medical field. So about the virus, what is your perspective on that?
With regard to the virus itself, clearly it's not the regular flu. It's much more virulent, meaning that it's much more easily contracted than what we consider the regular flu. Clearly, once it is found to be positive in a person, the course tends to be either asymptomatic or mild symptoms, the shortness of breath, or maybe a fever and it goes away, or in my aunt's case, a rapid declination in the patient and leading to severe respiratory illness and compromise or respiratory failure and potentially death. So it's much more serious than what we consider the influenza virus.
Right. And on the mask perspective, the president has made a statement saying, wear a scarf if you want, they're thicker. Is that the right way people should be viewing it? It's okay to go into public if you have a mouth covering over your face, even if it's a shirt or a cloth scarf. Is that really the perspective from a doctor's standpoint, that people should be okay hearing that and abiding by that as what the president said?
Well, I think the misunderstanding from the general population is that they think that the mask wearing, these regular masks, these scarves or bandanas that people are wearing, they think that it protects them from the virus. What it is it's protecting the population from your particles that you may expel and during your regular conversation or through a cough or a sneeze. None of these items is going to be 100% in its ability to prevent particles from entering the air, the atmosphere from you. It may inhibit some, but generally it's only to prevent others from getting the virus from you. It's not protecting you from the virus. The virus can enter through your eyes or any mucous membrane that's exposed or through eating. And what I see in a lot of the general public, particularly those wearing gloves, they're wearing the gloves and still touching everything and touching their face. And that's the big no-no about this virus. It is better to leave the gloves to the professionals and just wash your hands repeatedly. I think there was something I read that says you should just wash your hands every 20 minutes, regardless of what you're doing and where you are, just to be cautious. But I see so many people wearing these items and they're putting them on improperly, taking them off improperly, and it's just not anything that's good for the general population if you don't educate yourself on how to do it the right way.
Yeah, it scared the heebie-jeebies out of me when I was going to the grocery store after the president made his declaration that it's okay to wear masks. And I walk into the grocery store and everyone has on masks. And I know, like, if I'm saying that if you're wearing a mask, you might have the virus. So I was looking at it in that perspective. I turned around and I got back in my car and I didn't even go to the grocery store because I was a little bit scared after speaking with some expertise who know exactly what they're talking about. Before I let you go, we're going to take a quick break. I want to ask you kind of a question. It's kind of personal. But it's very interesting, and I need to know. So we're going to take a quick break, pay some bills, and we'll be right back.
Your quality of life is impacted by pests trying to make your home their home.
At Aero Environmental Services, we keep your family and pets safe from unwanted pests. To learn more, visit aeroservices.com and schedule your free total home pest evaluation today.
Aero Environmental Services provides effective pest control that improves your quality of life so you can truly relax and enjoy yourself with friends and family.
Welcome back to Michael Clayton Live. We're speaking with board-certified anesthesiologist Dr. Trelvis Ragin and MD. Can I be redundant and add the MD, Doc?
Yes, you can. Certainly.
So some people say they're doctors, but they don't have the MD behind their name, and I just want to brag on you a little bit. But I also want to brag on something else. It's not your titles at the end; it's actually your name in the beginning, Trelvis. I've never heard of that's a very unique name, Doc, and I just have to ask, How did you get the name Trelvis?
It's a product of my mother's creativity. I'm a child of the 60s. And Elvis was really big in the 60s. I think she thought it was a creative and very, very wise thing to do. So adding the TR to Elvis, you get Trelvis.
Oh, wow. So I'm trying to think. So mom is getting communion on Sundays and she's naming you after Elvis.
Yes, she is.
He wasn't the nicest young fella in the pew, was he?
He was, I'd say he had an exuberant personality. Yes, he did. Not the typical thing a Christian woman would be thinking of. I would not think. Yes, you're right.
But she was pushing the limit. She named you after greatness, though. I will tell you that. And you becoming a doctor, you living up to that name.
Well, I think I work as hard as he did, maybe. So, yeah.
Well, Doc, we thank you so much for your work and what you do. We send our condolences to you and your family behind your aunt passing away. And we wish your mom a healthy recovery moving forward. And we ask that you stay safe. We thank you for your support and love. And thank you for joining Michael Clayton Live.
Absolutely. Thank you for the opportunity.
If you would like to be a sponsor, please go to michaelclaytonlive.com or you can send us an email at michaelclaytonlive@gmail.com.